Alpha blockers are medications that work by blocking alpha-adrenergic receptors in the body. These receptors normally respond to norepinephrine, a stress hormone, by constricting blood vessels. By blocking them, alpha blockers help relax blood vessels and improve blood flow. Alpha blockers are primarily used for hypertension, helping to lower blood pressure by relaxing blood vessels. They are also used for benign prostatic hyperplasia, relieving symptoms like difficulty urinating by relaxing the muscles in the prostate and bladder neck. Additionally, they are used in specific cases like Raynaud's disease and pheochromocytoma, where blood vessel constriction needs to be controlled. Alpha blockers work by inhibiting the activation of alpha-adrenergic receptors, which normally cause blood vessels to constrict. By blocking these receptors, they lead to vasodilation, which is the widening of blood vessels, resulting in lower blood pressure. They also cause relaxation of smooth muscles in the bladder and prostate, improving urine flow and BPH. Common examples of alpha blockers include prazosin, which is used for hypertension and PTSD-related nightmares, doxazosin, which treats both high blood pressure and BPH, tamsulosin, primarily used for BPH to improve urination, terazosin, which treats both BPH and hypertension, and phentolamine, used in emergency situations for severe hypertension, such as pheochromocytoma. Side effects of alpha blockers can include hypotension, especially after the first dose, which is known as the first dose effect. Patients may experience dizziness and fainting due to sudden drops in blood pressure, as well as fatigue and weakness as blood pressure lowers. Reflex tachycardia may occur, where the heart rate increases to compensate for lower blood pressure, and swelling in the lower limbs, or edema, can happen due to fluid retention. When considering nursing implications for alpha blockers, it is important to monitor blood pressure regularly, especially after the first dose, to watch for hypotension. Educating patients about the first dose effect is crucial, advising them to take the first dose at bedtime to reduce the risk of fainting. Nurses should assess for dizziness and fall risk, encouraging patients to rise slowly from sitting or lying positions. Monitoring heart rate is also important, particularly for patients with heart conditions, to watch for reflex tachycardia. In patients with BPH, checking urinary function is essential to evaluate improvement in urine flow and monitor for side effects. Lastly, it is advisable to avoid alcohol and other antihypertensives, as they can increase the risk of low blood pressure.